For those who have been watching my videos for the past few months, this should come as no surprise and a welcomed announcement, I guess you could say. The World Health Organization has declared the Ebola outbreak a global health emergency. What does that mean? Well, it essentially just means that they will be getting more funding, more vaccines to the area, and those kinds of things. But as those who have been following my videos, you should know, and if you haven't, at the end of this video, I will put the playlist of my videos and you can check them out so you can get the information of what all has led up to this. Because most people are going to look at this, people that haven't been watching this, are going to look at this like, oh, it's just Ebola again. They've done this in the past, whatever. It's in Africa. It has nothing to do with me. Unfortunately, that's just how we are. It's like if it doesn't really affect me, then who cares? But it does affect you. And you will see that in my previous videos. The strange quarantines, the weird viruses that have been popping up that have never really been seen before, the media silence about each one of them, and all of those things, including the couple that died in Fiji that was from Texas. All of these things are connecting. And in my opinion, Ebola is here and it has been here. And you can find that in one of my most recent videos about how the connection with Missouri and all of these other things. Okay, so Ebola has been declared a public health emergency for multiple reasons, but of course they are still saying there's no travel ban. There's no need to worry. There's no need to worry about trade or traveling. Well, you can take that into your own hands. But like I said, if you haven't seen my videos, you might want to check those out. Because just because someone is not symptomatic with Ebola does not mean they're not carrying it. And scientific research shows that definitively. It also shows that people that have never even thought they had it actually did have it and are now immune to it. So that is one good thing. But the mainstream and those type of people are going to tell you that it has a 2 to 21 day inoculation period, and that's when you're going to get sick, blah, blah, blah. And then they are no longer contagious. It's absolutely false. People have gotten Ebola at the funerals of these patients and died. People have gotten Ebola a year after someone has been, quote unquote, cured from the Ebola. Studies have been done that Ebola has been found in semen for over 2.5 years after the person has been treated and cured from it. Okay? So this is a very strange disease that they honestly, and they even say that they don't know everything about. They just don't. There's different strands, and then from the looks of it, one strand mutated with another strand, and that's why this time it is so deadly. It has something around a 70% mortality rate. I'm not trying to scare you into staying into your house all day, okay? I just want you to know the facts. I want you to have all the information and, go back into my videos and see how to prepare and prevent these kinds of things. So does this have anything to do with it? I don't know. All I do know is there are too many very strange things going on with hospitals diverting ambulances, which I've absolutely never seen. Worked in the emergency room for years. I've never seen ambulances diverted from a hospital because somebody is infectious. What does that even mean? Like, the EMTs are now diagnosing people? This doesn't make sense. There's too many things that don't make sense. And I just want everybody to be prepared and aware of all of these very strange things going on. So we had a priest or preacher that was diagnosed and has since passed away, from what I understand, of Ebola in the city of Goma. The city of Goma has about 1 million to 2 million people. You know, different articles are saying different things, so I don't know, but I know they're next to another big city or something. So that seems to be kind of the game changer that made them say we can no longer not say that this is an emergency. And that's what made them declare this a global emergency. Also, you're going to hear that it is only contracted by bodily fluids, and no need to really all that much worry. And that's not really that true, because otherwise we wouldn't have people getting Ebola in 100 miles away, you know, or across the entire country, where their country is the size, about 1/3 the size of the United States, just randomly. And it's not like they travel like we do. You know, we could go halfway across the country in a day driving, right? Or flying, we could do it in obviously a few hours. So there are many things that need to be looked at, and not just, let me kind of start over. For those that don't normally watch this, the reason, you know, in prior years, we had the media making it into a huge deal. Everybody, you know, hide your kids, hide your wife, everybody be terrified. And that made me think, oh, they're just fear-mongering because they do it for ratings. But this time, they have essentially kept it quiet the entire time. That's when you need to get concerned. Because when the mainstream media, that's their job. Their job is to distract and divert attention from the actual situations. And when they are not speaking about something that's huge, that's what made me concerned. You know, and that's why I began speaking about this a few months ago. That doesn't mean, you know, get all terrified and everything. But I've done tons of research, and I have gotten with Dr. Gordon Peterson, and he is absolutely amazing. I cannot claim that this does anything, but let me show you. But it does help make you healthier. We will just say it like that. The link will be below in my pinned comments. It's going to look like this, and I'm going to have some arrows to it. And you can check out that link. There should be a 20% off coupon on that link. And honestly, that is what I would do. You know, I'm taking it, my kids are taking it, and I would definitely not recommend anything that I wasn't doing myself. But let's go ahead and take a look at the articles and see what they're saying about this. So this article from Time Magazine came out early this morning or late last night. It says the U.S. helped defeated Ebola in 2014. Now we're watching a crisis become a catastrophe. Well, that's uplifting. So the DRC is now a public health emergency. Let's look at what they are focused on, and they've mentioned multiple times. It says, but it stressed it should not close any of the borders, adding that the risk of the disease spreading outside of the region is not high. What a joke. Wow. And then, of course, he added that he has also accepted recommendations which stressed that there should be no restrictions on any travel or trade. You see what their real concern is? It's not about people dying. It's about their trade and about travel and anything that has to do with the economy. Doesn't matter how many people die. And this is what I've been saying from the beginning. That's what Fiji was so worried about. All about their travel, rather than just telling the truth. But they will be screening at all the ports. Let's not be confused. If you haven't been watching my videos, Screening means taking their temperature with a thermometer. So just a heads up, and if I hear anything else, guys, I will definitely keep you updated. Thanks, y'all. Y'all have a wonderful day. And if you would like to support my channel, all the links will be down in my pinned comments. Don't put them in the description anymore because YouTube doesn't like you leaving their site. So we now have to put the links in the pinned comments. It's just a whole mess. I'm not even going to get into that with the censoring and everything, but then whatever. I'm not going to get into that. But anyway, guys, y'all have a wonderful day.